Let me set the scene. You went to school and you learned how to help patients return to their prior level of function using all the best evidence-based evaluation and intervention tools as a PT or an OT. You're working at your first job. A few months in, your boss comes in to you and starts going over units per visit, how to optimize your reimbursement, and the number of patients on your caseload. They show your average units billed and the average number of treatments per week, and they start talking about how all that needs improvement. You've been treating patients how you were taught, using the best evidence, the best treatment tools, giving them all of your attention, and following all the legal billing principles. And now your boss is asking you to do things a little bit differently. You get that pit in your stomach, that feeling you know the right thing to do, but your workplace is now making that challenging. This is called ethical distress, the physiological struggle that occurs when your professional values don't line up with your workplace's expectations. So you have this knowledge of what is the right way or the right thing to do, and then you have this type of roadblock that's preventing you from taking the right path. And the result is this feeling of anxiety about what to do or frustration and guilt because you can't do the right thing. Hello, and welcome to another Clinical Connections mentoring video. In this video, I'm going to be talking about ethical distress. So I'm going to explain what it is. I'm going to talk about some examples you may find yourself in as a newer PT or OT, and then I'm going to talk about what you can do about it. So as a clinician, you've likely found yourself in a situation similar to the picture that I just created, and that resulted in ethical distress. In a career that's built on helping people, but is also a business that has to generate revenue in order to be sustainable, we're often faced with many instances of ethical distress. So my goal with this video is to help you recognize these situations and give you some tools to help you work through those situations. For anybody that does not know, I am Dr. Jody Miller. I'm a physical therapist and a mentor to PT students and new grads. I've worked in just about every setting that there is for PTs, and that includes both clinical and non-clinical jobs. So let's talk about this conflict, this challenge that results in ethical distress. So basically, you're wrestling between what you know to be right versus what your boss is telling you or expecting you to do. So, on one hand, you want to do what's best for your patients, things like giving them your full attention, only providing interventions that you know to be evidence based, following legal and ethical billing principles. But on the other hand, you can't afford to lose your job and your benefits, and you understand that in order to have a job, the clinic needs to bring in revenue, which is why your boss is asking you to do ultrasound with every patient and to bill certain codes or see multiple patients at one time. You get it. If there's no money, you don't get paid and you don't have a job. But you also get that it's your license on the line in your relationship with the patient. So it becomes this back and forth that do I do what's right for the patient or do what I do what is necessary for the clinic to survive and stay open so that we can actually help more people, which is why it creates this moment of ethical distress. And this is hard. It hurts, especially when you're a really good therapist. You became a therapist to help people, not make a clinic a bunch of money, right? So, what do you do in these situations? What do you do when you find yourself in ethical distress? So, let's talk about some specific situations. So, situation one, your boss is telling you that you need to start seeing 3 patients an hour. So, the problem is, you know that this won't allow you to provide effective treatment sessions. It's way too overwhelming and exhausting for you. You worry it's going to impact your relationships with your patients and your patients' view kind of the whole clinic as a whole. The solution here is to explain the situation to your boss. So I say things like, I've noticed when I double book specific high acuity patients, our outcomes drop and our patient satisfaction scores dip. Especially when you're essentially you want to connect the quality of your treatment to the clinic's bottom line. So just tell your boss, I'm worried if we do this too much, our patients are going to see that lack of quality and then they're going to go somewhere else for their PT. You can also explain that you're open to double booking patients, but only for the right types of patients. So you don't want to like shut it off completely. Just have an open conversation with your boss. I understand why we need to do it. I can't do it with all patients, but I'm willing to do it with certain ones. Situation two, your boss is telling you to have every patient start their session with 10 minutes on the bike and to bill it as Therex so that you can start to kind of overlap your patients. The problem here is that you know this is unethical and it's illegal billing because having a patient riding a bike for 10 minutes is not skilled therapy. You also know that not every patient needs that intervention. So the solution here, this can be appropriate if the patient needs it, but it still needs to be skilled. So it can become skilled simply by assessing the RPE or heart rate or oxygen levels periodically during that 10-minute period. So you can also have this conversation with your boss. Explain to them that you don't mind the overlapping, but you need some support in place to do so, like a tech that can track the oxygen or track RPE and then report it back to you. Situation 3. Your boss is telling you that every patient needs to be seen 3 times a week. The problem is, not every patient needs to be seen 3 times a week. Some patients only need to come once a week. Some don't even have to come some can come every other week, right? You know it's not good ethical practice to schedule every patient 3 times a week. Solution here is to use the APTA Code of Ethics kind of as your shield. So explain to your boss what the APTA Code of Ethics says, and being asked to schedule everyone 3 times a week really violates that code because it's not appropriate for every patient. Explain you'll do it when it's appropriate, but not for every patient. Next situation. Your patients met all of their goals, but your boss is telling you to keep them on the schedule for 2 more weeks so you can generate more revenue, or so that the clinic can meet their revenue goals. The problem here is your patient has met their goals, so why do they need to keep coming for 2 more weeks? This is an ethical dilemma that brings finances into question. So you should never make someone come to therapy just to make more money. There always has to be a skilled need for more therapy. The solution here is to start with reassessing the rehab goals and the patient's goals. So, can you make new goals that continue to progress the patient, or have they truly maxed out their potential? Has anything changed since the last assessment? Is there still room for some improvement? So, if the answer is yes to either of these, then make new goals and continue to treat the patient. If the answer is no, if they've truly met their maximum potential, then discharge is your only option here. Think about if this was your family member. Would you want them to continue if there's room for more improvement? Or do you think more visits are unnecessary and wasteful? Explain all of this to your boss. Say things like, I've checked, I've assessed everything I can, and there really is no more room for improvement for this patient, and would be fraudulent if we keep them coming for therapy. All right, the last situation is your boss is telling you to bill for units that you did not provide because the revenue for this month is coming up short. The problem here is this is flat out illegal and fraudulent billing and should be a hard stop in any situation. You absolutely risk losing your license in this situation. The solution here is that if your boss or clinic is telling you to bill for units that were never provided, it is time to hand in your resignation. That's the only situation here, or the only solution in this situation. This is a full stop. You do not want to be associated with a clinic that operates this way, and the end result is never good for the clinician. If you find yourself in this situation, it is time to leave and find another job that is much more supportive and legally sound. As a new grad, I understand that it can feel like you have to say yes to everything that your boss asks of you, but this is simply not true. I understand that you likely have a significant amount of loan debt that you need to pay off, and you need this job in order to do that. But losing your license is not going to help here either. No clinic's revenue goal is worth your license or your integrity. Your license is your most valuable asset. You cannot be a therapist without it, so don't put yourself in jeopardy of losing it. If you find yourself in a clinic where the bottom line is more important than the patient, and you've brought up these concerns and you've been ignored, it's time to find another job. There's still some really good clinics out there that do put the patient over the revenue goal, but you do have to do some work to find them. Remember, you didn't become a therapist just to make a clinic a bunch of money. You became a therapist to help people. And just as a side note, I have literally said those words in a job interview because it's important to me. So I have said those things and I've gotten the job. Yes, revenue is important to keep a clinic running, but it can't become more important than the human experience and the patient care. It also can't become more important than your license. Do not put yourself into situations where your license is at risk. Also, remember that your documentation can protect you. So, if you have documented skill for your interventions, then justify your billing. As long as you made the correct legal and ethical decisions, your documentation is going to protect you. Lastly, I want to touch on the fact that communication is key. So, if you are being asked to do these things that do not feel right, you need to have a conversation with your boss. In every situation, this that I provided, the solution was to have talk to your boss, right? Both parties need to understand where each person is coming from. However, if nothing changes after the conversations or you feel that you're not being heard, then it is time to leave that job. But you have to start with a conversation. You can't ignore the ethical requests, especially if they feel off. You have to bring up your concerns because if you don't bring them up, you aren't guaranteed that they won't go away. Okay? If you don't bring up those concerns, you're guaranteeing the fact that they're not going to go away. They will still be there. Having the conversation also allows you the potential for support and brainstorming with your boss to find solutions that will work, that are ethical and legal. But again, if nothing changes after these conversations or your boss continues to ask you to do those unethical and illegal things, then it's time for a new job. So it's important to understand ethical distress, understand what it is and what to do about it in those situations. Because for new therapists, ethical distress is one of the leading causes of early career burnout. If you spend 40 hours a week acting against your own moral compass, you stop feeling like a great clinician and you start feeling just like a worker bee. Recognizing that this is a documented phenomenon and not just you being difficult or being that difficult employee is the first step to managing it. And trust me, I understand that speaking up as a new grad can be very terrifying. But if you keep your head down, you don't address the issues that lead to ethical distress, you're going to burn out of this profession. You're not going to be a PT or OT for very long. And if you're burned out within 2 years of getting your license, you're not going to last long. But if there are ways to manage both ethical distress and burnout, and I can help you with that. So reach out if you have any questions about how I can help or what it looks like to work with me. We would love to have a conversation with you. I hope you learned something new today. Please go ahead and drop in the comments your aha moment or something that really stood out for you, something new that you learned. I want to thank you for watching. If you have any questions about what I talked about today, please feel free to message me or leave your question in the comments. I'll see you next time.